A tragedy has occurred in the United Kingdom, calling into question the basic professionalism of the whole medical system. 77-year-old Amy Francis from Newport died at the Royal Gwen Hospital after a surgeon attempted to remove her liver instead of her cancer-affected right kidney. Considering her age and underlying conditions, the operation was supposed to be performed using a minimally invasive endoscopic method, so-called keyhole surgery. At first glance, nothing complicated. A small incision, removal of the organ, a routine procedure. Consultant urologist Adam Carter even decided to entrust the key moment to a trainee doctor, as if it were a practice dummy rather than a living person. The result of this training session turned out to be horrific. The trainee began the procedure, noticed something strange, and instead of stopping and calling for immediate verification, simply stepped back. Carter then took the instruments himself and, confidently grabbing the organ, pulled sharply. The organ he somehow managed to confuse with the kidney turned out to be a part of the liver. The patient immediately experienced a severe drop in blood pressure and massive bleeding began. Surgeons rushed in to save her life, but it was too late. Forensic experts diplomatically described the incident in the final report as unintentional liver damage. In reality, it was a blatant ignorance and unacceptable overconfidence in the operating room. Yes, the family of the deceased accepted the official findings with dignity. Yes, the son thanked the doctor for his honesty, but the essence remains appalling. An elderly woman was entrusted to an unexperienced trainee, and a qualified surgeon failed to distinguish a liver from a kidney. Only after this tragedy they did review the case and modify the surgical technique. In other words, the patient became a victim of unprofessionalism first, and only then the doctors did decide to learn how to operate properly.